we get into the 3 different treatment options, it's important to understand how the thyroid hormone replacement medications work. Okay. There are 2 main types of thyroid hormone replacement medications. The first one is called Levothyroxine, or LT4, and as you might have guessed, it's a synthetic version of the T4 hormone. T4 is the inactive form of the thyroid hormone, but don't let that fool you. Once it's inside the body, it gets converted into the active form of the hormone, which is T3. So the second type of thyroid hormone replacement medication is Liothyronine, or LT-3, and this is the active form of the thyroid hormone. So now that we know the basics, let's talk about the 3 different treatment options. The first option is levothyroxine monotherapy, or in other words, taking the LT-4 hormone by itself. This is the most common way to treat hypothyroidism, because levothyroxine is effective in normalizing the thyroid hormone levels, and alleviating most of the hypothyroid symptoms. It's also a very stable and long-acting medication, which allows for once daily dosing. And it's also widely available and well-regulated. But despite all these benefits, some patients continue to experience symptoms like fatigue, mental fogginess, and even weight gain despite having normal levels of thyroid hormones. This is likely because the conversion of T4 to T3 is impaired in some individuals. And this could be due to genetic variations or other conditions like liver disease. The next option is combination therapy with both T4 and LT3. So this treatment option is based on the idea that if you can't convert T4 to T3 effectively, then why not just replace both hormones directly? And this may be beneficial in the subset of patients who don't respond adequately to LT4 alone. Some studies have shown that combination therapy can lead to improvements in mood and cognitive function. However, evidence regarding its superiority to LT4 monotherapy is mixed, and some studies have shown no significant benefit. Now, combination therapy does have some potential drawbacks. One of the concerns is the risk of cardiac arrhythmias, which is mainly due to the higher levels of T3. Other adverse effects, such as irritability, tremors, and insomnia, have also been reported. And the long-term safety profile of combination therapy is still not fully investigated. The third option is Desiccated Thyroid Extract, or DTE. Now, DTE is derived from the thyroid glands of pigs, although it can also be extracted from other animals like beef and sheep. It contains a mixture of T4, T3, and other thyroid hormones, including the inactive forms of T4 and T3. Now, some patients do report better symptom control with DTE, especially when they feel that LT4 is inadequate. Now, it does provide both T4 and T3 in a more natural ratio compared to the synthetic versions. However, there are concerns regarding the variability of T4 and T3 content between batches, and the fixed ratio of T4 to T3 in pig thyroid extract is different from the physiological ratio in humans. Now, most healthcare providers do recommend levothyroxine or other brands of this as the first-line treatment for hypothyroidism. And the decision to use LT3-DTE or combination therapy should be individualized based on the patient's symptoms, medical history, lab results, and personal preferences. It's also really important to monitor thyroid hormone levels closely with any of these therapies to make sure that you're not over-replacing or under-replacing your thyroid hormones. If you found this video helpful, please hit the like button and subscribe to the channel. Thanks for watching.